10% of people in North America think they're allergic to penicillin. And when you do formal assessments for them, 90% or more actually are not allergic. For the most part, people are diagnosed because of a delayed rash, but really we know now that the rash is because of the infection itself. But the problem is it doesn't get delabeled over time. Everyone who thinks they're allergic gets a different antibiotic, and these alternate antibiotics cost more and they don't treat the infections as well. So overall, it's a big cost to the system, and then we have poorer care overall. In my role as an allergist, we're uniquely trained to assess risk of drug allergy. So I thought if there are thousands of these people out there and over 90% are not allergic, surely they don't all need to wait in line to see an allergist. And so I set out to develop decision-making algorithms that other providers could use to find low-risk patients to delabel on their own. In the early days, this was just a personal project, and we were able to demonstrate good sustainability in delabeling processes here. At some point, the Spread Quality Improvement Program became developed, which is one of the JCC programs, and they were looking for programs to spread good projects that had demonstrated sustainability, and they came upon ours.
What I see the JCC's role is that they are creating the conditions for innovation to thrive. So this isn't just a project, it's actually a model of how collaborative investment in physician-led change can improve system performance. The funding allowed for the project infrastructure, the coordination, the data tracking, and implementation support, all of which you really do need to expand in a very meaningful way.
What we had to do was create a whole new learning system. So this had never been done before in British Columbia, and we called it the Penicillin Allergy Delabeling Sprint. We created a leaner process to bring teams together more efficiently in a one-year learning model. And after the 1 year period, we had data showing that we assessed over 800 patients and had over 600 labels of allergy removed. And that's only data from half of our teams.
With the penicillin delabeling tool, we were able to successfully delabel my child penicillin allergy. So it gives you confidence in the healthcare of your loved ones and your family members and yourself. And that proved extremely useful when a couple years later we were traveling abroad. My child needed an antibiotic for a common childhood ailment, and we had the knowledge to understand that we can proceed with penicillin safely. My hope is that this project and initiative will reach more families so they can take ownership and they can be an active participant of their future health care.
This is an incredible story to show that frontline projects can make an impact, and it does take a team effort and collaboration, be it government, health authorities, doctors at BC, frontline clinicians, and patients as well.
Doing this work as a team and with other clinics is there's such a sense of community and shared learning. And I think that's what spread and quality improvement is all about. It's not about reinventing the wheel. Relatively simple things can make a huge impact if they're done effectively and are spread appropriately.
I just feel a deep sense of pride in this. The support that JCC has provided has given me the opportunity to develop my leadership skills, but empower other physicians as well to be leaders in their own clinics, in their own communities.